So today we're looking at the eye, inspecting the eye. First things, I'm just going to look at the patient's eye, make sure the colors are good, that it's symmetrical. I can look at the pupils, make sure they're the same size. Look at the eyelashes, see if they're going inward or outward. Eyelashes, no hair loss, that they're symmetrical, everything like that. Next, I'm going to ask the patient to pull his lower eyelids down and look up for me. And I'm just looking to make sure there's no bleeding, any abnormal spots, anything like that. Good, that all looks good. So there I was looking at the sclera, cornea, and lens. Next, I'm going to palpate I would palpate the lacrimal gland and sac, but I'm just going to have the patient, so if you can just push right in here. Good, and do you have any pain with that? And can you do it to the other side too? No, any pain with that? Good, so there I'm just seeing if he has any pain and seeing if any like white substance leaks out of the eye, which there wasn't. So next I'm going to use the scope. Yeah. Now with this, just going to have my patient make sure his feet flat on the floor, just in a comfy chair, and you can just kind of look ahead at the distance back here. I'm just going to look in your eye. What I'm looking for here is red reflex. And then I'm going to go in, look for the optic disc, any crescent that I might see, and then I'm going to look on the other side of your eye for the other thing. Forgot what it is. Yeah, that's what it is. So, right, I should stand to the side and not do that. Right eye. There we go. Good, cool. I was able to see the red reflex and the optic disc. Yeah. So next would be the PDRRLA. Inspect pupils equal, so we already did that. Shine light obliquely. Alright, where's my pen? I thought I had it right here. My bad. Alright, so if you can go like this and just kind of put your hand like that, I'm going to shine the light just to check that your pupils dilate correctly. I'm going to do it tangentially. Good. Good. And now I'm going to do it and look at the other eye. Good. And good. That was for direct and indirect response. Next, what I'm doing is just testing that your pupils contract and expand when you're looking at a close object to a far away object. So first I'm just going to have you look at my finger here, and then look away in the distance, and look at my finger again. Good. So when you were looking at my finger, they were contracting, and when you looked away, they were expanding and dilating. Next is corneal light reflection. Here what I do is I just shine a light in the middle of your forehead and make sure that the corneas reflect the light equally on both sides. So I'm just going to have you look in the distance again while I do this. And they're both shining back at me equally, so that's good. Next, I'm just going to draw a pattern with my finger. I just want you to follow it as best you can, with just your eyes, don't move your head. Good, so there I'm looking for any lid leg. There was no lid leg at all during that. I'm looking for his eyes to like kind of stutter as he's looking at it, which didn't happen at all, so that was all normal. Next is the cover-uncover test. So if you can just use this to cover one of your eyes. Am I shining it?
I think so.
Alright. And then go to the other one. I think this is right. Good. So the visual field test. So here I'm just going to be testing his peripheral vision. Patient, what I'm going to do is I'm just going to come forward with my hands, and I just want you to know, or you can raise your hand whenever you see my hands on either side, okay? All right. Good. Good. And good. And was that equal on both sides?
Nope.
Good. So there I'm just making sure his peripheral vision is good. He can see equally for both. The last one is the visual acuity test. Here I would be using a Snelling eye test chart. We're just going to kind of talk about it, not go over it. So I would just tell my patient, I would just have him about 20 feet away from the eye chart, and I'd ask him to read the smallest line possible. As long as he gets 50% of the line correct, I can ask him to move down to the next line and keep doing that until he gets it incorrect. And that's just testing his overall vision, seeing how his eyes are. And that concludes the testing.